Hello, aviators. This is Dr. Cole Weatherby with Denver AME and AME.answers, and today's October 3rd, 2024. I mentioned the date because I realized that the FAA is changing stuff, and so by the time that you watch this video, the information I present today might no longer even be correct. So I want you to understand when this video was recorded. So as of today, these are the current guidelines. I'm recording this short video today to let you know about a new important guideline regarding the treatment for low testosterone. In the past, the FAA did not require pilots to give any sort of documentation if they were on treatment for low T, with a few exceptions. But now they've come out with new criteria, and so henceforth, when you go in to get your medical exam, there are some things that you're going to have to show your AME in order for your AME to be able to issue your medical certificate on the spot if you're treated for low T. And if you aren't able to produce those things or can't produce them within 14 days of your exam, then the FAA is going to be forced to defer your exam and you're going to have to give information to the FAA. So let's talk through these new guidelines. So I guess before I get into that, let me tell you why this is important in the first place. I always like to go over this so that you don't build up more resentment about additional hoops that the FAA is asking you to jump through. So I think it's important for you to understand how this came to be. Basically, for treatment for low testosterone, there's about 1% or less of patients who develop something called erythrocytosis, which is an increased number of red blood cells. And the reason that is bad is your blood can get thick and you can have blood clots. And those blood clots can happen anywhere in the body, but it's especially bad when they happen in the heart and cause a heart attack and possibly death. So the American Endocrine Society has decided that you need to have your blood count monitored at least, I think, every 6 months if you're on testosterone replacement or some other testosterone therapies, to make sure that you don't develop that additional risk factor. So that's the main reason that this guideline exists, is because they don't want pilots to be having heart attacks when they're flying or any other time. From what I've been told from the FAA, there haven't necessarily been events of a pilot having a heart attack from this issue in flight, but there have been some pilots affected, during times when they weren't flying. So let's talk about what this new guideline is. It is a CACI, and I'm not talking about tan-colored pants. I'm talking about these worksheets. So a CACI worksheet, it stands for Conditions AMEs Can Issue. And CACIs are guidelines that allow AMEs to review medical information and issue a medical certificate on the spot, provided that you meet the criteria. And that's important because otherwise, there'd be conditions that we would constantly have to be deferring certification to the FAA. So best educate yourselves on the different CACIs that are out there, because they cover a lot of common conditions and they can be really useful and help you get your medical certificate faster. So let's go into the guidelines for this new CACI for low T. So this guideline was released, or the CACI worksheet was released on September 25th, 2024. And it states, to determine the applicant's eligibility for certification, the AME must review a current detailed clinical progress note generated from a clinical visit with the urologist, endocrinologist, or treating physician no more than 90 days prior to the AME exam. And for pretty much every CACI out there, this is the primary requirement. So they want you to see your doctor within 90 days of your exam with your AME, and they want that doctor note to say certain things. They also specifically say this has to be a detailed clinical progress note, and that does not mean necessarily the note that you can print out from the patient portal. They want the actual, what is called a SOAP note, printed out from your doctor. So it's the clinical note that your doctor uses when they are, keeping your medical record. So be sure that you get the right note from your doctor to get to the AME. So let's talk a little bit more about what they want to see here. They want that progress note to state that your condition is stable, that no changes are recommended, and that you're not having any side effects which would interfere with flight duties. And that should be really specifically spelled out in black and white in the note. They also want you to document, or your doctor to document, that you haven't required treatment with phlebotomy and that you don't have a history of cardiovascular disease, thromboembolic events, or prostate cancer. This is a big gotcha here. So in the past, these conditions weren't necessarily problematic with getting your medical certificate if you were on low T therapy. Now, if you have any of that history, cardiovascular disease, thromboembolic events like clots in your legs and things like that, or prostate cancer, you will not be able to qualify for the CACI, and you will need to be put on a special issuance if you're on low testosterone therapy. So if you have one of those conditions, you should reach out to your AME proactively and start working on the process of getting a special issuance in place, because that can take a good amount of time. Another requirement is they want you to have a CBC, or a complete blood count, performed within the previous 90 days. That shows that your hematocrit is 54% or less. And then they spell out the different medications that you can be on, and which ones are acceptable, and specifically one that is not acceptable, which is N-clomiphene citrate. But if you're on anastrozole, HCG, Testopel, testosterone, or clomiphene, then you will qualify for this CACI. So if you show up to your medical exam and you're able to produce that documentation and have a recent lab result, your AME can issue your medical with no problems at all. If you are not able to produce those documents and you can't produce them within the 14 days that an AME has to transmit your exam, we are forced to defer, and you're going to have to submit that information ultimately to the FAA, who has to give you your medical certificate after reviewing it. So if you have any questions about this, I encourage you to reach out to your AME and talk through it. This is a big change. There's a lot of people on testosterone replacement therapy, and so it's going to affect a lot of pilots. And I just wanted you all to be aware of it so that you are good to go when it comes time for your next medical. As always, if you like my content here, give me a thumbs up and subscribe to the channel. And please send me any questions that you have to the email address down in the description or in the comments. You can start a conversation in the comments, and if I have time to respond, I will. If not, maybe I'll make a video sometime in the next few months. Thank you so much.